Stitchcraft, double-flanged charms for capsular tension segment for the luxated lens. This video is a highlight on the usage of capsular tension segment through the double-flanged 5-0 technique. Nil financial disclosure. The case revolves around a 72-year-old male patient who presented with LOCS grade 5 cataract in the right eye with pseudo-exfoliation. Following thorough biometry, he was found to have a magnitude of astigmatism of 1.48 diopter at 10 degrees. A toric IOL implantation via phacoemulsification was planned for this gentleman. Let us now go through his surgical journey. Following initial preparation of the patient, a 5.5 mm continuous curvilinear capsulorhexis was made. Hydrodissection was done. The nucleus was then prepared for emulsification by the stop and chop technique, and the fragments were emulsified as and when they are created. The first trouble began when we experienced difficulty in rotating the nucleus during the chopping process, owing to the bulky nature of the nucleus. Soon after, a suspicion of weak zonules arose when there was an apparent tremulousness of the bag with the nuclear material in the infranasal quadrant. We now had at hand two hurdles to cross over. One was the bulky nucleus, which was stubborn to the routine technique, and a looming danger of zonular laxity. A step-by-step action plan began formulating in the nimble mind of the surgeon. Stabilization of the capsular bag became the priority. The surgeon had three widgets under his belt: capsular hooks, capsular tension ring, and the capsular tension segment. A surgical call was taken to first use the capsular hook to stabilize the bag until the end of the nuclear emulsification process. Two Makul capsular hooks were employed and the nucleus emulsification process was completed without hassle. Bimanual irrigation and cortical aspiration were done, and we now proceeded to deal with the next issue at hand. Focal zonular dialysis could be made out, extending for about 4 clock hours about more than 120 degrees. Capsular tension ring 11 was then taken as our second device of choice, considering the axial length of the eye was 22.70 millimeters. The CTR stabilized the bag and enabled the establishment of capsular symmetry so that further surgical steps could be done. The next obstacle arose when there was vitreous detected in the anterior chamber. Diluted triamcinolone acetonide was used to stain the vitreous, and an anterior vitrectomy was done. The goal now was to provide long-term stability and to prevent tilting of the bag following the IOL implantation. The capsular tension segment was the ideal weapon of choice, considering that the zonular dialysis, which extended beyond 120 degrees. The first step to CTS was to establish a sclerotomy with a 26G needle at about 1.5 mm posterior to the limbus adjacent to the area of zonular weakness. A 5-0 proline was then inserted into the anterior chamber subsequently. In the first attempt, the needle made contact with the posterior capsule, made apparent by the wrinkling of the posterior capsule at the needle tip. The needle was hence withdrawn and a reattempt was made. Viscoat was used to create adequate space in the ciliary sulcus plane to ensure a successful reattempt. A new sclerotomy was made at an alternate site, and additional help was sought using an iris spatula in the ciliary sulcus to guide the needle into the appropriate plane. The suture was then fed into the needle lumen and externalized. The corneal end of the suture was passed from front to back via the central eyelet of the AIOCMT CTS. Handheld cautery was used to create the first flange of the double flange at one end of the suture. The entry wound was extended and the CTS complex was then eased into the bag. The toric IOL implantation followed behind and went on seamlessly. Visco wash was then done. The CTS was adjusted into its final place and the other end of the suture was cut and cauterized, creating the second flange of the double-flanged technique. The suture end was then anchored to the scleral tract and covered over by conjunctiva. The 1-month post-operative pictures stand testament to the success of this elaborate surgical technique. Thank you.